All right. Hello, everyone. I'd just like to let you know that we're live on YouTube right now. So, I would allow the streaming to be recorded. I will let be the co-host, but we're live, so everything you say or do is live on. Are you able to record it on your end?
Yeah. Hello. Good evening, everyone.
Good
Doctor,
evening.
who are you speaking, Dr. Brian? Mm.
It's Brenda. Welcome, Pelagia.
Welcome.
You're
Thank you
welcome.
very much. Um, Let me notify the people on the page that we're about to start a meeting.
Okay.
Sure. Um, Good evening, everyone. Can I be heard?
Yeah.
Loud and
Yes.
clear.
Mm.
So you are welcome to the first session of the University of Ghana Medical Students Association Alumni Mentorship Mentorship session. I would like to welcome everybody. We are very grateful to our speakers, to everybody that's made this program a success. A lot of hard work and planning and postponing got into this meeting, but I'm glad that God made today possible. So, on that note, I'd like to invite Dr. Bubunia Palu to give us the opening prayer so we can start the meeting.
Hello, everyone. Please let's share with the prayer. Heavenly Father, we thank you so very much for the gift of life and for the gift of today. We thank you for this opportunity to meet together as alumni, to share ideas, to share our experiences, and also to lead young ones into the future you have designed for them. I pray, Lord, that even as our senior colleagues share with us, that we won't just be hearers, Lord, that we'll do the things that they tell us to do, that we would experience bigger and better as you have planned for us. We thank you and we bless you for a successful program. In Jesus' name I pray with thanksgiving, Lord. Amen.
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 Thank you so much, Dr. Bubuni Apalu. So Dr. Bubuni is one of the members of the committee that was spearheaded by Dr. Brenda and Dr. Betha Ayi to start up the mentorship and career guidance committee. And the program basically is going to start with the class of 2024, which is the most or the freshest of graduates from the University of Ghana Medical School. So without much ado, I'd like to, since we have just about 2 hours to go through this program, I'd like to start by introducing our first speaker. So our first speaker is Madam.
Yeah, I'd like to make a few comments before we get into our first speaker. Okay.
Yes.
All right. So good afternoon, everyone. My name is Dr. Ayi. I'm the president of the University of Ghana Medical School Alumni Association. I want you to know that this is being live streamed on YouTube so that you can share the link and that others can watch. So this series came out of our last but one annual general meeting where the younger members of Alumni Association expressed a desire for career counseling and mentorship. It was a long time coming, but finally we delegated it to Dr. Brenda Addo, who has been able to mobilize over 40 of her classmates plus others who are ready to mentor the young medical graduates from the medical school. And it's going to be ongoing. We're starting with just internal medicine. Some people have volunteered to do surgery as well. But I realize that there are a lot of alumni on here who are much older. I'm hoping that as you join this, you will see how it's being done. And like in the area of radiology, for example, I see Dr. Rakatata on here, that you will all see the vision and be willing to be part of this and provide some guidance for our young graduates. And we're also hoping that as we provide this value added service to them, they'll become more engaged in the Alumni Association and see it as not just another body somewhere, but something that is providing value to them. So I want to thank Dr. Brenda Addo, thank Dr. Eunice Hammer, Dr. Josephine, Professor Josephine Apalu, Dr. Mesidoni Kwame, and Dr. Patrina Tichi for volunteering to be part of this first series. So on this note, I just want to thank all of you. I'm still on the road, so I'm going to go on mute, and then the program can continue. Thank you all very much for
Thank
joining.
you. Thank you, Madam President.
Thank you very much, Dr. Betha, and thank you very much, Dr. Brenda, for making this program possible for us. So I would like to start by introducing our first speaker for today. So she's in the person of Dr. Eunice Semenyo Hammer. She holds an MD and FACP, and she's an academic hospitalist at the Piedmont Athens Regional Medical Center in Georgia, USA. So she's, as Dr. Brenda said, she's one of the alumni from her year group. So she's a board certified internal medicine physician and academic hospitalist based in Athens, Georgia. She completed medical school at the University of Ghana Medical School and did her residency in internal medicine at Morehouse School of Medicine. She has more than 25 years of experience, and Dr. Hammer serves as an academic hospitalist at Piedmont Athens Regional Medical Center, where she also contributes to medical education as an associate program director and head of inpatient medicine for the internal medicine residency program. She's also an assistant clinical professor and at the Augusta University in partnership with the UGA Medical School. Her clinical expertise spans general, internal medicine, and hospital medicine, with interest in complex inpatient care. And we are very happy to have her with us today. So without much ado, I'd like to welcome Dr. Eunice Hammer.
All right. Thank you very much, Dr. Awula, for that warm introduction. I hope you can all hear me well. So, can you all hear me well?
Yes, we can.
Yeah. Sorry, I have some background glare. I'm out of town and I had to look for a quiet place to have this meeting. So, you can keep my slides for the second half. So, the first half, I'm just going to tell you about my journey, where I got to where I am, what I did. You might learn a little bit from that. Then I have a few slides I'm going to go through. So, as Dr. Awula said, I graduated from class of 1997, even though we graduated in 98 from University of Ghana Medical School. After that, I did my housemanship. I did 6 months pediatrics and 6 months surgery. After my housemanship, I was posted to Reach Hospital, where I did internal medicine. For me, going to the US was not part of the picture. I never did my USMLE when I was in medical school. I was happy working in Ghana. I had a good job. I was happy with my family, everything. Then my husband decided to go and do his master's MBA in Atlanta, Georgia. And he said he was not going to come back. So to keep my family together, I moved to the US. That was right after September 11th. So when I got there, my husband said, you have 1 year to do your step 1 and step 2 because things change in America. I want you to quickly do your step 1 and step 2. He put pressure on me. I had my son who was 2 years. It was really a struggle combining the two. But I put in my best and I did fairly well. And I pursued residency. Now, for me, staying in Georgia was a big thing for me. And I'm going to come back to this. For you to choose a career, it depends on a lot of factors, family factors. And for me, keeping the family together was something I wanted to do. At that time, that's about 20 years ago, Morehouse and another medical center were the only two places in Georgia which was IMG friendly. IMG is International Medical Graduates. The other facilities like Emory and Augusta were not sponsoring visas. So I was limited if I wanted to stay in Georgia and I wanted to um, have residency, I was limited to Morehouse and Atlanta Medical. Luckily, I had interview with both places that were interested in me. Morehouse was doing only J visas. So for those of us who are not American citizens at that time, you had two options, H visa or J visa. J visa is very restrictive, but if I wanted to stay in Atlanta, that was my only option.
Yeah.
Um, all right. So I went on a J visa 3 years, and J visa is an exchange visa. When you take a J visa, you promise to come back to your home country or work.
I'm not to give you.
Somebody is talking.
Then I'll be say you get the box.
Somebody is talking. If you can mute the person.
Okay. You
Yeah.
you use this one. Are you using this part?
Awula, can you
Please-
mute?
Yeah, please mute
I
yourself.
do some parts like this, or where the good talk take.
It'd be like a straight one.
Is it Lord or somebody? Okay. All right, good. So I did my residency 3 years in Morehouse. After the 3 years, they wanted me to stay as a chief resident, but they couldn't guarantee sponsoring my visa. And after September 11, everybody wants to get off your visa. You want to go where they can sponsor your visa. So after 3 years of residency, I was interested in cardiology, but because of my family situation, my kids were tired of mommy being away. I couldn't pursue my dream of cardiology. I wasn't even ready to put the work into it. So I had to take a job. After internal medicine residency, you have 3 pathways. You can do inpatient medicine, that's patients admitted to the hospital, or you can do outpatient medicine, that's office work alone, or you can do fellowship, pursue a fellowship. With my unique personal desires, I decided to pursue hospital medicine, which I love. So I have been practicing in inpatient medicine for over 15 years. I love it with a passion. I'll choose it again if I have to choose. I only deal with patients in the hospital, non-surgical patients in the hospital. So I have worked all over Georgia. The last 10 years, I've been working with Piedmont, Athens. I started off as a non-academic hospitalist. That's what we call ourselves, working in inpatient medicine. Then the last 5 years, I've focused mainly on medical
We
education.
mentor doctors, young doctors. So this is I'm supposed to be
somebody is
speaking after
still
her.
talking.
So.
Can we please mute everybody, please?
All right. So
I
currently,
think the host can mute everybody. Dr. Awula, please mute everybody. You can mute. You have the capacity to mute everybody. Sorry.
So currently, I work in Piedmont, Athens. I work with internal medicine residents. It's international, friendly to international medical graduates. We have a lot of them. For now, we have a lot of them. And inpatient medicine, I also teach medical students on their inpatient rotations. And I'm currently the associate program director at my program. So that's been my journey. The unique characteristics is putting family first. Staying in Atlanta meant a lot to me, and getting somebody to sponsor my visa. All right. I don't know if you have any questions or about my journey. Okay. Otherwise, I can go to.
Dr. Hammer, there will be a question session, so you can flow, and then after we are done, questions can come in from all speakers. Thank you very much. And I've unmuted. So if you want to unmute during the question session, you'd have to raise your hand, and then I'll allow you to unmute. Thank you very much. Sorry for the interruptions.
Okay. So you can quickly go through my slides. This is a slide I present this to my residents during their second year when they are making career choices. So can you put it on? All right. So next slide. So for you as a medical student, how do you decide what to do? First of all, you have to understand yourself, what matters to you. For me, staying with my family, staying in Georgia and getting visa sponsorship. For some other people, it might be the money. It might be something else. All right, next slide. And next slide, okay? So understand yourself. Know what matters to you. Some people will say, I want money. I want money, 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 money. I don't care about anything else. That might be what you want. For some people, they want to be a cardiologist. They want to be a gastroenterologist. They want to do something fancy. It means a lot to them. I wanted to do cardiology, but was I prepared to put the work in? You have to do a lot of research. It's very competitive. Then you got to look for somebody who will sponsor your visa. Then work-life balance. My kids were tired of mommy being away. My daughter used to cry, Mommy, when I come to my school, you're always away. So those are things that matter to you. You have to choose what matters to you. Do you want to be a place where you have a church community? Do you want to be active in your church? So you have to know yourself and what matters to you. Next slide. Now, once you know what matters to you, explore your options. If you want to do a fellowship in cardiology, you want to pursue endocrinology, whatever you want to pursue, get exposed to what it entails. Have a mentor in that field. For us in America, we have Ghana Physician and Surgeons Foundation, GPSF, and Dr. Ayi knows a lot about that. They can arrange for you to have a mentor, talk to somebody in that field, know what they do, know what sacrifices you have to make, know what it entails, the years you have to put in, you have to know all that before you choose a career. So to summarize, know yourself, explore the options you have, know what it entails, and finally, you make a decision. Next slide. So step 3 is make a decision what you want to do. Choose a specialty and work towards it. All right. Next slide. All right. And for us doctors, we have several options to do. Even in internal medicine alone, you have several options. You can be an inpatient person, a hospitalist. You can be outpatient alone. I knew straight from go that I don't like outpatient. I don't like patients waiting for me. I want to do things at my own pace. Then fellowship is an option. Now, I want to talk a little bit about the residency program in internal medicine. Now, when you apply to internal medicine or residency in the United States, there are a lot of things that matters, and I have a summary of what matters. Your medical school transcript matters. Put in your best when you're in medical school. Work hard. Even if you think you're going to America, work hard. Work hard and work hard and work hard. We don't like seeing failures on your transcript, okay? Then also work hard when you're doing your USMLE. The two have to be a mirror image. You cannot do well in your medical school, then the USMLE, you don't do well. But the USMLE for us is a standardized test, and we want to see that you are doing well. Doing well probably means getting above 240. Okay, we see some people do well in their medical school, then their USMLE, they get 218. It's not a mirror image. Probably you had great inflation where you went to medical school. Sometimes we don't even know the medical school you went to. So USMLE is our best standardized test that we can look at. Then US clinical experience is a plus. If you have the opportunity, and Ghana Physician and Surgeons Foundation can link you to someone who would help you with a US clinical experience. And when you're having this US clinical experience, some people call it observership or clinical rotation, make sure when you're having those rotations, you have a diary. Document exciting things you see, because you're going to use it to write your personal statement, all right? And when you go for these experiences, let the doctor or whoever you're following know that I need a letter from you. And whatever I have to do for you to give me a good letter, let me know. So we in my program, we don't do observership, but a few people come through and I tell them, if you want me to write you a letter, I have to see that you are participating. I have to have something to write about, because those letters have to have content. And I have to see something I can write about. I cannot lie. So when you have this, when you go for these clinical experiences, talk to whoever you are with. Tell them, I need a letter from you. And whatever I have to do for you to give me a good letter, let me know. Then work experience also matters. So don't rush and leave Ghana after your medical school. It's good if you do your housemanship. It's good for us to know that you worked in Ghana. Whatever you learned in medical school, you worked and you used it. It's good. Don't come and stay in America and be writing exams and don't have any clinical experience. Clinical experience matters. Then the letter of recommendation, that's the LOR, should be solid letters. It should have content. Okay, so you might have to help your letter writers, but we just want to see, oh, hardworking and a team player. No, give examples. How was this resident a team player? Give examples. You should have content. Then research also matters. Get yourself involved in research. It might be writing up an interesting case, or get yourself involved in research. Then lastly, volunteer work. Make sure you are involved. And it's simple. In Ghana, it's very easy. Your church, just go know your numbers club. You see people from your church checking their blood pressure, checking their blood sugar, and just educating them. So be involved in volunteer work, have a leadership position, form a group. And it's funny when you see somebody's application and they say, I have this group for only 1 month. It doesn't tell me much. So it should be like 1 year, 2 years I've been involved in this. All right, next slide. And finally, this is my last slide. When you come for the interview, know about the program you're interviewing at. Okay, go to their website, learn about them, learn about the people they have there, the program director, their background. Then when you come, we're going to ask you, do you have any questions? Have a question. Okay, don't come and say you don't have any questions. So ask about research opportunities, mentorship, the program strengths. You ask them, what do you want to change about your program? Those are questions you can ask. Then always have a good internet connection. You know, you don't want to be going in and out when you're being interviewed, and have a quiet background and dress professionally, and don't be distracted when you come for the interview. Then when they ask you to share an example, be clear and concise, okay? AI is my new friend. Ask AI about internal medicine interviews. AI will tell you a bunch of things you can ask, things you can say about yourself, and have a format to use. And lastly, is showmanship. You should sell yourself, sell your qualities, and give examples. Don't just tell me you're a team player. Give examples, and I think that is about it. So to summarize, know yourself, know what matters to you, expose yourself to what you want to do, and choose a career path. Oh, the last slide. Let me just quickly go to the very last slide. So I have certain resources on the last slide. Residency Explorer. You can log on. It tells you about the programs, which programs sponsor visas, what they do, where their graduates are. Then GPSF, Ghana Physician and Surgeons Foundation of North America, is a good resource. You can join and be active. They'll give you mentors. Then double AMCs, American Academy of Medical Colleges, they have all kinds of things about choosing a career. So in a nutshell, that's my story, and that's residency in the United States for internal medicine. Thank you.
Thank you very much, Dr. Hammer. That was very insightful and concise. You stayed within time and you even have 2 minutes to spare. And we
Excellent.
thank you very much for all the wonderful things you shared with us. We'll make good use of the resources for those interested in pursuing a career in the US. Okay, so would want to move on quickly to want to stay within time. So want to move on quickly to the next speaker. So the next speaker is our very own Dr. Katrina Ankra. If she can hear me, she can unmute. I tried to ask her to unmute. I don't
Hello,
know
can you
if
hear me?
Oh, great. Thank you. I just wanted to make sure it worked out. Yes,
Okay,
please, we can hear you.
okay. I'm not sure whether you can see me. Can you? Okay, that's it. All right.
Yeah, we
And
can
it was
see you
good to see.
clearly.
Okay, you can see and you can hear me clearly as well.
Yes, please.
Okay, excellent.
So I'll introduce Dr. Katrina Ankra briefly. So this is Dr. Katrina Ankra. She's a medicine physician specialist and the director of Alcon Medical Center in Tema, Ghana. So a brief history. Um, she has a Master of Science in Cardiology, and she's also a health leader. She is a physician with a Master of Science in Cardiology with more than 20 years of clinical and leadership experience in Ghana and the UK. She's director of Akon Medical Center, Tema, and she provides comprehensive care in acute and chronic disease management, preventive cardiology, weight management, and lifestyle medicine. She's passionate about women's health and health promotion, and she combines medical expertise with research, policy development, and patient-focused innovation to improve community well-being. And I'm sure we are all eager to hear what she has to say in terms of pursuing a career in Ghana and also pursuing a career in the public health space, as well as entrepreneurship and leadership. So without much more to say, I'd like to invite Dr. Katrina.
Hello,
Thank
can
you.
you hear me?
Yes, please, we can hear you.
Okay. Just in case I go off, I'll just sort of have to rejoin. Because where I am right now, the signal of the Wi-Fi is not very good. I'm not in Accra at the moment. I'm in one of the West African countries. But thank you for the intro. Sometimes I don't recognize myself when I'm introduced. But as it is, I also graduated from medical school, University of Ghana Medical School in 1998. And I did my house job in Kolebu Teaching Hospital. And afterwards, whilst I was doing my house job, I was a bit confused as to what I really wanted to do, to specialize in. I started working at CTU as a medical officer then. And at that point, I thought, well, then the natural course.
Hello, Dr. Katrina. Can you hear us? You went off for a while. Hello, Dr. Ankra. Dr. Ankra. Dr. Ankra. So we lost Dr. Anka for a while. We are hoping she joins us soon. So while we wait for her, we could have our next speaker. She's trying to work on her network currently, so hopefully we can have her join us back very soon. So if our next speaker is ready, we can move on. We can move on to our next speaker. Yes. So our next speaker is okay. So we can move on to
Someone was asking that we unmute them. It says iPhone. Do you think it's Dr. Katrina?
yes, please. I think it's so I'm trying to unmute her. I'm working on that. She initially had her name, so it was easier. Okay. Dr. Katrina. Dr. Katrina.
Yes, yes. Can you hear me now?
Yes, please. We lost you for a while.
Yes, I do apologize. I'm in Guinea-Bissau at the moment, and here the Wi-Fi is not very great. So pardon me if I go off again. I'll try and rejoin. So let's say I'll start again. That I qualified in 1998. Actually, Eunice, who spoke earlier, was my mate. And afterwards did my housemanship in Kolebu Teaching Hospital. I did in medicine and obs and gynae. Then I went ahead to work at the Cardiothoracic Center as a medical officer. But as I said, even though the job was challenging, interesting, and initially I got sort of quite bored doing the same thing, was either something through the heart and the heart and the heart and the heart all the time. And then I realized earlier on that I liked with medicine, seeing patients. I like the variety of seeing a range from right from time babies to adults and right into the elderly. So quite just as I was doing that, I just thought, you know what, I think what I'd love to do would be family medicine, because then you've got a lovely case mix. And I remember in the first I did say you've got to know what you want. You want to know what you love doing in medicine. And that's very, very important. Because if you know that from the start, then medicine doesn't become a chore. You don't wake up in the morning and go, God, I have to go to work every day. You actually enjoy what you do. So I thought, you know what, at a point, definitely I want to go into family medicine. So even though I worked at the Cardiothoracic Center for a while, I think I was there for 4 or 5 years. And I went ahead to go and do an MSc in cardiology. That was the plan. When I got to the UK, then I got married at that point and thought, well, let me just go into general practice. So I went into general practice and I enjoyed it. And of course, the background of cardiology, adding it to the mix was great. But I was the kind of person that I knew, you have to know yourself that even though I've gone ahead and done PLAB 1, PLAB 2, and that's if you want to take the UK route. And I'm sure Mercy would elaborate on that a lot. A place, and to get a place, you may have to go in and do some voluntary work. It's very important, and as well as look for some hospitals to also go in and do some attachment. These are unpaid attachments. And those ones are not easy to get. In our time, many years ago, it was difficult, but I guess this time is even worse. But you just have to keep on trying. You send applications, and then eventually each one will fall through. And it's also good to also link up with Ghanaian doctors who are working in hospitals already. And they can also help you get those placements. That's if you're thinking of the UK routes. And when you've done those attachments, then you add it to your CV, and then I guess looking for work becomes a bit easy. It's not a bit easier to do that. That was our time. So basically, on my roots basically is I worked there, did general practice, had my child, and thought, what, as I guess. With me, I get easily bored with staying at one place. So I thought, whatever it is, I still want to practice in Ghana. So I still maintain my license to practice in Ghana and maintain my license to practice in the UK. So then if I had the chance, I'll come to Ghana and do a little bit of work, or I'll come to Ghana and go and sit at CTU and do a bit of work. And whilst I was in CTU, actually, we started with Dr. Edward Adates and thought, why don't we set up an echocardiography service where we sort of go to the private hospitals and provide them a service of echocardiography and interpreting their ECGs for them. It's sort of a primary care cardiology service, because we realized that was a need in the community based on what sort of referrals were coming into CTU. So we started off first, we used to go to the Pentecost Hospital in Adenta, and then we moved to Nyaho, and then hence to Tema. So we used to travel around with a small echo machine, doing these tests for these hospitals. Though it was tiresome, our benefit there was we sort of widened our networking. We sort of got to know a lot more other primary care doctors and got to know other private hospitals. And that also helped us in our career path, such that when we eventually decided to place a diagnosis center in Tema, because there was nothing at all in Tema, most of the private clinics in Adenta, the Tema area, knew us already. So we started off with just echocardiography, doing ECGs, doing 24-hour Holters and 24-hour blood pressure monitors. And in between, we started a service where we would consult on maybe once or twice a week, where we'd see patients.
Hello, Dr. Angra.
Referrals to the cardio, referral to quality. So it was all about medicine. When you start working, it's about, especially in Ghana, it's about networking, which is very important. And don't have no calms and I always tell my young ones that please be humble and be ready to learn. Be ready to listen to other people. Be ready to be helpful. Sometimes not just for the money. Sometimes you may have to forget, initially you may have to forget on money a bit and just build up your client base, build up your network of other doctors, other specialists within your environment. And that's what family practice is about, if that's the route you want to go to. because as a family practice physician, you always need to refer either to a cardiologist, refer to an OBGYN, refer to an internal medicine specialist, refer to a gastro, refer to urology. And it's good to have a good network of doctors in these specialties in Ghana. With me working in the UK meant I also had to network to have all these other people on my list. Basically, at the end of my basic by end of a call, so that if I had to refer a patient, I had to speak to somebody for advice, I would do that. And my aim was not just to work in Ghana and the UK, but my aim was to work across West Africa. My aim was to be able to connect doctors across the West African region and hopefully across the European. That's my plan. And that way it means you'd have to always be ready to speak to other doctors, to invite people over, go for dinners, get involved with people, basically, get involved with other doctors. I mean, my journey also took me to working with the past government for 8 years as a physician to the past president. I wasn't sort of called for an interview. I worked with him, I looked after him. And those times I remember he would want to pay me. I would say, no, I'm sorry. I don't need any payment because I just wanted to basically I was trying to build my network of good clients in a certain economic or financial level in Ghana. So of course, when he became president, he invited me to be his doctor. And that was that's when my career really took off. Because doing that job, I got a lot of opportunities and met a lot of other doctors in the West African region, in the African region, in Europe and the US, and that helped. And that helped build up my practice that I have today, such that I travel around the West African region looking after different clients all along the West African region. That's why I'm in Bissau today. So my advice to you is you should for those wanting to do a combination of Ghana and the UK, or who don't want to leave Ghana and still have the option of working either in the US and Ghana or in the UK and Ghana, you should be ready to do lots of travel, which doesn't help if you have a family, especially if you're a woman like me. You have a partner who understands you. And you've got to sit down with your children and get them to understand that this is what brings in the money. So it's not easy. My daughter tells me that she'll never become a doctor because doctors don't have time for their children, which was a bit of a blow. But then I took it as now she's 15 and she's beginning to understand why mom had to work, why her mom had to travel. But it's not easy. But as I said, be ready to work initially, not for the money, but for your clients, for your name, for networking. And once that is established, the money follows. Now, working across the regions, what you need to do is learn about the different countries. What are the requirements working there as a foreign doctor, and how can you work there without having to pay that full licensing fee. And in my case, I do that by working with doctors in those countries. So then I just go and get a temporary license to cover me for the period I'm there, and then I'm gone. But so that when I leave, my clients still can speak to those doctors in there, and they would still reach out to me if need be. So we sort of have a nice network across the West African sub-region, which is good. And then again, that allows me to have time with my daughter, time to have a holiday, time to sit back and relax, which I didn't have the first, let's say, 18 or 19 years of practice. But it's been tough, building it up, but you've got to be resilient. Things are not easy out there. Medicine is changing by the day. Make sure you use AI, make sure there's ChatGPT, make sure you try to incorporate that into your practice, because COVID basically taught us that medicine, you can still practice medicine if the person is not right in front of you, unless of course you're a surgeon, it's a different cup of tea, or the patient needs to be in front of you, but you can actually triage lots of cases and refer to whichever specialist needs to be referred to. So medicine is changing, and I would want to advise you guys to basically learn a bit of AI and see how you can incorporate into whatever specialty you want to do. One, and be ready to learn. Try and learn a different language, because I always say that, look, Ghana is surrounded by French-speaking countries, but very few of us know how to actually speak French. So much later, 5 years ago, I started learning French, and I had to learn it on my own. And I went to Duolingo. I took online classes from somebody in France because I wanted that accent. And gradually I built that app so that once I go to French-speaking countries, at least I'm able to communicate. If you want to learn Spanish, if you want to learn Portuguese, whatever language that you want takes your fancy, just go ahead and do it, because it's going to help you. But the main languages I advise is get your French in, get your Spanish in, and you'll be able to get your way around most of the African countries if you're interested in working across Africa as well. So that's my bits. I think I don't want to talk too much, and I don't want to overshoot. If anybody has any questions, I'll be happy to respond to them. I'm in Ghana. I spend my time in Ghana, in the UK, and in some West African countries. But Western countries, I just spend a few days there just to see patients. But most of the time I'm in Ghana, 50% of the time in Ghana, another 40% in the UK. And that's how it is. Now in the UK, for those who want to go to the UK, when you've worked in the NHS, you could also look at getting yourself associated with some of the good private hospitals in the UK. These days, some of them offer a private GP service. So they'll be happy if you kind of find out about it, have a good relation with them, and maybe get yourself attached to them. And then you could also take that path of working as a private GP, and which is also lucrative. Or it could be a standalone GP and do locums in different hospitals, including private hospitals. That's another thing you could also do in the UK. And now for general practice in the UK, I don't know how easy it is to get into, because as I said, it's almost 10 years or more now since I started practicing as a GP, but there's a lot more opportunity as a GP, especially as a private GP, than in the NHS now, I would say. That's what I'm finding out. But whatever you do, my advice is practice in the government sector, but the ultimate thing is for you to be an entrepreneur, for you to form. Don't try to do a work alone. Try to always work with partners. That way you can free yourself time, give yourself time for your family, give yourself time for other curricular activities that you'd have to do, because life is stressful enough, and you need to have that escape for your own wellness, for your own mental health, for your own for the well-being of your family, and that's very important. Money, yes, is good, but the well-being whilst you have money is best. So that's my bit of advice to you.
Thank you very much. Thank you very much, Dr. Ankara. That was very insightful. We learned a lot about how to balance it all. It seems like you have it all figured out in terms of balancing the traveling and then life of an entrepreneur, being a director. And we hope that some of those logged on to this meeting will be able to learn some insights from that for their career path in the future. So we'll quickly want to move on. But before we move on, I'd like to ask if you have any question and you want to text it into the chat box, you can do that now, so that immediately the last speaker is done, we can start the question session. Also, allow for those who want to ask questions to unmute. So you can raise your hand or ask to be unmuted, so we don't have interruptions during the meeting.
Okay, and I also leave my number and my email for anybody who wants to reach out for any further questions, advice, recommendations, introductions. Okay, at the end.
Yes, please. Thank you very much, Dr. Ankara, once more. So So we'll move on to our next speaker. So our next speaker is Dr. Mercy Donny Kwame. She is going to be giving us insights from the UK because she is a specialist, an acute medicine consultant at the UK. So she's an acute medicine consultant at Queen Elizabeth Hospital in Woolwich, London. She holds a postgraduate diploma in clinical education and also has a master's in leadership and management in healthcare. She has a special interest in medical education and also works as a medical examiner in her trust. She completed medical school at the University of Ghana Medical School in 1996, and she's happy to share her journey with us today to becoming an acute medicine consultant working in such a busy hospital in London. So I'd like to welcome Dr. Kwame to the call. Dr. Kwame. Dr. Kwame, please, are you able to unmute?
Yeah, okay, I've unmuted. Can you hear me?
Yes, please.
Okay.
Thank you.
Apologies, I'm at a family event, so there might be a bit of background noise. I graduated in 97, but I'm with class of 96. Came to the UK straight after graduation en route to the United States and met my husband, got married, had one child, went back to do my house job, during which time I had a very bad experience in my rotation in pediatrics. I'd wanted to do peds, but a young child who was about the age of my daughter came in, had been force-fed porridge and aspirated and died. So that put me off peds. And so that was out at that point. Had 2 more children. 6 years down the line, I was sitting at home, not doing anything with my life. And that is where your alumni connections come in. One of my juniors, Dr. Labisian, came to visit and decided I had to do PLAB. I could not remember a thing. I had to look in the medical textbook to find out the meaning of atherosclerosis, basically, at that time. So he found me a study buddy who is now your representative for UK and the rest of the world, Dr. Albert Topoku. Really smart guy. He did all the learning, and basically that was me done PLAB 1 and 2. With 3 children under 5, he did the studying, helped me through the exams, and I managed to pass PLAB 1 and 2 at one sitting. So keep your connections with the alumni group because they are very helpful. As Patrina explained, back in those days, once you passed the exams, you had to get clinical attachments. Then you go on to get, the idea of clinical attachment is to expose you to training in the UK, get UK experience so that you can get a reference from the United Kingdom. So getting clinical attachments was also very tricky. God was so good to me. I spoke to my GP and the GP managed to get me onto a clinical attachment scheme. After clinical attachment, you need to get registration. In those days, it was catch-22. You had to get registration. For registration, they would say you have to have a job. And when you apply for a job, they'll say you have to get registration. So basically, people were applying everywhere. In hospitals where they were really, really desperate, they would apply for your registration for you. I had 3 kids under 5. There was no way I was going to do many applications. I was just praying one day on the corridors. One Nigerian consultant saw me and asked me if I had a job, and I said no. Fortunately for me, I didn't have visa problems because I had a British passport. So he gave me a week's locum, and with that, I was able to get my registration. Started locuming at King's College Hospital. back in those days, you sort of fashioned your own training. I just wanted to be a GP, do a few rotations in medicine, few rotations in surgery, you're done, you were a GP. To go into medicine training, to become a specialist in any of the medical specialties, it was a lot of whom you know, people speaking up for you to get the various rotations. So I was looking at King's, wanted to get a substantive job, and they told me I had to do MRCP Part 1. 3 kids, and at that time my eldest was 5. I mean, it was very difficult, but I attempted the exam, failed by 0.5 or something ridiculous like that. But then I got the job. And then because I almost passed, I decided to persevere with the exam. And God being so good, the rules changed in the country. They decided that everyone had to apply for specialist training because specialist training was now being conducted by training schools. So you have the School of Medicine, School of Surgery, School of General Practice. So because I'd already done MRCP Part 1, I applied for internal medicine training and I got in. So then, did Part 2, PACES, and then the rest, they say, is history. By God's grace, I got a specialist training number in acute medicine and CCT'd after 7 years of training in medicine. And I got a consultant job in the very hospital where I started off, which is Queen Elizabeth Hospital. Once you become a consultant, you add on a few things. So I did clinical education. I was the lead in my hospital for internal medicine training. And I also work as a medical examiner. Basically, that's to do with scrutinizing deaths and making sure that, people delivered good care and things like that. And if they didn't, then, you'd have to investigate the cause of death and stuff like that. So that is what I do outside of my clinical work. Please, yeah. So, which brings me to training in the UK. So if any of you want to come to the UK to do a medical specialty, I just want to go through what training in the UK entails. There's the foundation training. So as soon as people come out of medical school, they go into foundation school. So you have foundation year 1 and foundation year 2. Foundation year 1 is linked to medical schools. So basically, if you are coming from abroad, you cannot get a job in foundation. You have to come in either foundation year 2 or as a junior clinical fellow, equivalent of senior house officer level. After you've done that, now they've introduced something called multi-specialty recruitment assessment, MSRA. So with the MSRA, all the UK trainees, when you finish foundation school, you do your MSRA, and with that, you go into specialty training. So if you want to go into GP, you apply for GP. If you want to go into internal medicine, you go into internal medicine. If you want to go into surgery, you go into surgery. In internal medicine, there are 2 stages. There's stage 1 and stage 2. Stage 1 is 3 years, where you do 4 monthly rotations in various medical specialties. So you do 4 months in, say, gastro, 4 months in cardiology, 4 months in neurology. And the whole idea is that medicine is now becoming more generalized. There's more the generalistic approach to medicine than the specialty approach, because a lot of the things that were done by specialists are now being done by acute physicians. So for instance, as an acute physician, I would look after a lot of the gastro patients. The gastroenterologists mainly in a lot of the general hospitals, all they do is to do the interventions. So they are trying to give a very general approach to internal medicine for people to get that foundation before they go into their specialty training. So you do these 4 monthly rotations, and then the 3rd year of the stage 1, you do 2 6-month rotations, one of which would be the rotation that you want to get into. So if, say, you want to be a gastroenterologist, the 3rd year of your IMT stage 1 training, you do, say, acute medicine and gastro. If it's neurology, you do acute medicine and, say, neurology. And then you go on to your specialty, the specialty in medicine that you want to do. And you do that for 4 years. And then you come out, and then you called your CCT, and you become a consultant. In stage 1, you are expected to have your full MRCP before you move on to stage 2. So you have to do MRCP part 1, MRCP part 2, and PACES in your stage 1, which is IMT1, IMT2, IMT3. By the end of IMT3, you should have your PACES before you get on to stage 2. In stage 2, apart from your clinical work, you just go to conferences. Before you exit, you have to do a specialty exam. So every specialty has an exam. Acute medicine has a specialty exam, gastro has a specialty exam, renal has a specialty exam. And once you pass that, then you become a consultant. If you don't pass it, you get stuck. You have to do it again, or you would have to become a specialist and not a consultant. So coming from Ghana, what will I suggest? So anyone coming, if you want to come to the UK training in Ghana, what I'll recommend is that do 2 years at home, because the foundation years are 2 years. So do, if it's possible, do 2 clinical years in Ghana before you come. You do your PLAB 1, you do your PLAB 2, and then you come in to do your, once you've done PLAB 1 and PLAB 2, you then come in to do your clinical attachment. You find clinical attachment. But once you get the clinical attachment, there are things that I would recommend you do in the 2 years that you are in Ghana working, because those would be on your application and those will give you an advantage. One of them is clinical audit or quality improvement projects. These are things that you can do in your hospital, wherever you are. You can do a clinical audit, you can do a quality improvement project. Teaching experience is one of the things that are ranked highly on any application in the UK. So it could be you developing teaching for medical students, having a degree, extra degree in teaching, something to do with one of the things that they hold highly is having some degree or diploma or whatever in teaching, and then developing some teaching for students. The evidence that you have to provide is the feedback. So a lot of people will say, oh, I've done teaching, but the feedback from your teaching is what. So keep all that, the feedback you got from your teaching and the certificates that you got. And your audits as well, you have to write your results and document everything that you do. The third thing is on every application in the UK, leadership and management. So your leadership, there's clinical leadership and non-clinical leadership. Clinical leadership is held highly, but non-clinical leadership is also good. So if you are the leader of your choir of some big organization or whatever, that needs to be on the application form. And then clinical leadership. So maybe you led on something, led on teaching, led on the management of something. So in the 2 years before the time before you come to the UK, those are some of the things that you need to look into, like leadership, look at your leadership skills, and that would sell you on the application. And the next thing is publication. So you need to publish something in the newspapers, wherever. You should have some form of publication. So these are the things that on every application form, these things would be there. And you would have to have evidence that you have something, and that would give you marks and carry you on. So after doing your PLAB, you do your clinical attachment, and then you look for, you have to get your jobs. The good news is that right now, you don't need, it wasn't like the catch-22 for us where you needed to get a job before you got your registration. Right now, once you pass PLAB, you get your registration straight away. So once you've got your registration, the difficulty is trying to get a job because it's really quite competitive. Some of the hospitals who offer clinical attachments also try and offer jobs. So this is where your alumni connections can come in. People can signpost you to places where you can get clinical attachments where, they may be able to facilitate you getting a job or getting you more experience. So you get in touch with the Brenda, and they can signpost you to the right places with the UGMSA alumni cohort. Applying for jobs, I will recommend that there are these jobs that are not training jobs, because most people, so it's all training school. So after foundation year, UK graduates are expected to go into training. But there's a pause. There's there are these jobs that people take whilst deciding on what specialty they want to go into. And that is where I think an international medical graduate should target or aim for. And those are called junior clinical fellow jobs. So they are non-training jobs, and those are the ones that you should look for, because that will give you some experience, UK experience, before you go into your specialty training. And also the specialty training is quite competitive, so you are much better off looking for a JCF post. So you get your JCF post, and during that time, same thing, try and do audits, try and do some teaching, get some leadership experience, and get some publication. It's a mantra that keeps going wherever you are as a clinician in the UK. It's part and parcel of every stage of your training. You make sure that you are doing audits or quality improvements, because patient safety is a big thing. And the QI projects and the audits are all to show that. Hello?
We can hear you now.
Can I continue?
Yes, please.
Okay. So the QI projects and the audits are all to show that you understand the principles of patient safety. So that is, it's quite important to do that. So if you do a JCF post during that time, you can then decide on what specialty. So perhaps you've decided that you want to do medicine. I mean, people have different reasons. And I think medicine is such a beautiful specialty because there are so many specialist interests that you can go into. So as I explained, you have to do the stage 1. What I will recommend is that try and get your exams out of the way, the MRCP Part 1, Part 2, and the PACES. During the JCF time, you can do those exams and do your MSRA as well. Because once you get into training, trying to do the exams and combining it with clinical work and all those things can get very tricky. So try and get your exams out of the way before you go into your IMT stage 1. The first 3 years are supposed to be for you to write exams. But what happens is that the work gets very tedious. People don't, especially if you have family, it gets very difficult. And then people can't get time to write the exams. And as soon as you get to IMT 3 and you don't have exams, you're out. You can't progress. So get the exams out, get your membership out, and then that makes it possible for you to really enjoy the training. During that time, you can attend conferences where you can present, and that also adds to it gives you more points on your application. During the 3 years, you get exposed to various specialties. So you've done rotations in respiratory, gastro, cardiology, and that is when you decide on what specialty you want to do in medicine. So the first 3 years, especially the first 2, you have rotations exposing you to the various medical specialties to help you make an informed decision on what specialty you want to go into. Then it comes to IMT 3, you've made up your mind that you want to do, say, renal or neurology. They'll allow you to do 2 specialties to help make you decide on a firm decision. So 2 specialties that you want. So you do, say, renal and neurology, or whatever 2 specialties that you really are deciding on. Pass your PACES, you get those specialties, and then you start the next stage. The next stage, and throughout your training, as I think Eunice said, you need a mentor. Get one senior clinician who can guide you, advise you, because you may meet educational supervisors or supervisors who can give you a hard time. A lot of us coming from Africa are very work conscious, but what will speak for you is your portfolio. You can work hard, you can be everything, but your portfolio is what will speak for you. And a lot of people fall short because they go to their appraisals and there's nothing on their portfolio. So if you have a mentor guiding you, telling you where the real points are, yes, the practice of medicine is nice, but you really need to, there's so much more to it than just the clinical work. You are expected to demonstrate so many other skills. So for the skills that you are expected to demonstrate is your clinical knowledge and skills, your practical skills, audit and QI, teaching skills, leadership skills, and your publication. Is the same mantra throughout your training. You have to demonstrate all these things on your portfolio and at appraisals. You get into specialty training, which is the stage 2. You decide that you want to do gastro. So at this point, it's just pure gastro, but then you'll be doing medical on calls. So you still do some GIM because, you know, medicine is quite, is the broad base. So your on calls will be in, say, acute and general medicine, but your specialty is gastro. So you learn to scope, you learn to do all the things that you do, you see your gastro patients. At the end of, and that's for 4 years. So that specialty training is for 4 years. At the end of the 4 years, or before the end of the 4 years, you write a specialty exam. So with that specialty exam, you then get your CCT and become a consultant. If you don't pass the exam, as I said, then you're kind of stuck. You are given chances, but if you cannot pass that exam, then you become, I don't know what happens to them, but some people go through various protocols to get certificates and stuff like that. But the straightforward route is pass your exam, you CCT, and you become a consultant, and then you find a consultant job. As a consultant in the UK, you are also a manager. You manage teams. So it's useful to try and get some form of certificate or training or something in leadership and management in healthcare. I chose to do a master's. Some people go for short courses, but it is very, very challenging. I mean, just jumping from just being, so it's quite useful to get those skills before you CCT, because it can be very daunting, especially for those of us who did not train in the NHS, coming from, and especially for me, I'd stayed at home for 7 years, just doing stop it, you know, chasing after children. So it was very difficult, but the masters really helped me to be able to understand what was required of me as a consultant in terms of leading teams, managing finances and managing the teams, and really understanding what the NHS, what underpins the whole NHS structure, you know. The reason why it's important to get some experience first before going into specialty training is that you can have all the knowledge in the world, but the NHS system is quite complex in the sense that our health and social care is interlinked. So you may know all the medicine in this world, but you might find it very difficult to work in the NHS because as the systems are, protocols are totally different. You know, referral systems are different. It's health and social care. So you're looking at people. I mean, a patient comes in, you finish treating the patient, and you're thinking she can go home. And they say, oh, no, she can't, because she needs a house. She needs a cleaner. She needs, you know, so you have to think about all that. And it gets very challenging. So ideally, that's why I'm stressing that before you jump into specialty training, get some experience, get clinical attachments, get some experience as a JCF before you jump into specialty training. I think that sort of sums up what is required for IMT training and, yeah, getting medical training in the UK. Yeah, I think that's me done. Thank you very much.
Thank you. Thank you very much, Dr. Mercy. Thank you for opening our eyes to the pathway in the UK. We are almost a bit behind time, so we would like to invite our final speaker. She's our very own mother from internal medicine department. And I was on medical too the entire time in medical school, and I've deeply been admiring her from the back. And I'm really happy that we could hear from her today. She joined in at the last minute, but we are glad that we could have her to share her insights on her journey to becoming our head of department. She's the immediate past head of department of internal medicine for the Kolebu Teaching Hospital, the medical school, UGMS. So I'd like to give a brief introduction and invite her to come to speak. So she's an associate professor, the Department of Medicine and Therapeutics, the University of Ghana Medical School, and a consultant physician and endocrinologist at the Kolebu Teaching Hospital. So without wasting much time, I'd like to invite Prof. Prof. Hello, Prof. Please, are you able to unmute yourself?
Yes, I'm able to do now. Thank you. Can you hear me?
Yes, please.
Okay. All right. So if you'd, I want to share my screen. So yeah. So thank you very much for the introduction and for this opportunity to be part of this program. As has already been said, I was originally not sure I could be part of this program. But I thank God that I'm able to join in at the very end. I was not quite also sure exactly the scope of what was to be done today, but judging from what the earlier presenters have done, I probably will have to tell you a bit about myself. I didn't include that in what I was going to say today. And so I'll just say something briefly about my journey and then rush through some of the slides. I thought the focus was more about the training in Ghana. So I'll just say something about my journey and then we will go through a bit about how the training in Ghana goes. So I'm of the class of 1997, as has already been said. So Eunice and Patrina are my classmates. After qualifying, did my house job, medicine and ONG. After that, usually once you're done with your house job, during our time, we did it for 1 year. And once you're done with your house job, you become a medical officer. And then of course you start thinking about what next. At the time, I would say medicine has always been my first love. I loved medicine when we're doing our rotations. But I also later on got to know that I also loved surgery. And so I was torn between the two. Should it be medicine or I should go and do surgery? And at the time, my husband was already doing medicine. So I said, no, if I go to medicine, they'll say I'm following my husband. So let me go and try my hands at something else first. So I decided to try something in surgery. And I said, let me do something that as students, I didn't have the opportunity to really get a lot of information on it or skill and knowledge about. So I went in to do ophthalmology. So I did ophthalmology for a year. I enjoyed it, but it was quite tough at the time because at the time I was pregnant. And I think the number of doctors at the ophthalmology unit at the time too was a bit limited. And so you could stay in the clinic from morning till sometimes 6 p.m. just seeing patients. And I think it was getting a bit too much. So one day I had a discussion with my husband, what should we do? What should I do? And he says, well, your first love is medicine. So why don't you come back to medicine? And so I think a lot of the ophthalmology consultants then thought that he came and dragged me out of ophthalmology back to medicine. But medicine had always been my first love, as I said. And so I went into medicine, started the training in 2001, did the membership examination 2004, and then followed up with a fellowship examination in 2007. And when I finished the fellowship, all I wanted to do was just practice my medicine in peace. But then other people had other plans for me. And so people kept asking my senior colleagues, won't you apply? Won't you apply in medical school? I said, well, I don't want to add that to my portfolio. I just want to practice my medicine. But I think in the long run, they persuaded me because even though I was not part of the medical school, I was teaching the medical students anyway. And so at the time, the head of department, Professor Faye, persuaded me. And so I joined the medical school. And that was, I think, 2011, 2012, thereabout. And then started as a lecturer. and rose through the ranks until my current position. But in 2020, there was the need for a new head of department for the Department of Medicine. And I mean, all along my life, I said, the head of department is going to skip me because there are lots of other senior members ahead of me. So it was not something I ever really thought about. But it so turned out that at the time, the two people ahead of me that I said, oh, these people are there, and so they would pick one of them. For one reason or the other, they couldn't do the job. Not that they didn't qualify, but the circumstances at the time were such that they couldn't pick that job. And when the dean asked me to step in, I couldn't say no. And so that's how I ended up being the head of department for Department of Medicine from 2020 to 2024. And so that's what my journey has been like. It's not been straightforward. I've veered into areas that I never thought I would, but it's always good to listen to those ahead of you, listen to colleagues, listen to your mentors, and the plan may change. You may start off as something in a particular area, but based on how life goes, things may change. And some of them may be for personal reasons. Some of it may be for improving your career or moving up ahead in your career. So that's what my journey has been like since qualifying from the medical school. I would now move on to speak a little bit of why you should consider internal medicine, and then just touch on briefly about the training that if you decide to train in Ghana, what it looks like. And so for internal medicine, we know it deals with non-surgical diagnosis and treatment of diseases affecting adults, and sometimes may involve the diagnosis and the management of complex multi-system diseases. And personally, practicing internal medicine, I found it very rewarding and it's a very intellectually stimulating experience. People decide to choose internal medicine for various reasons, just like how when we were having our interview to become medical students, we had various reasons to enter medicine. The same way when it comes to specializing, people have various reasons why they choose a particular subspecialty. It may be personal, it may be an intellectual reason, it may be your career. And as we've heard from previous speakers, sometimes it has to do with the money and all that, which is also very important. But what are some of the things that will let you decide as a freshly qualified doctor, will let you decide that I want to do internal medicine? So it's about adult medicine, yes, but we tend to look at our patients' data, their history, their examination, their investigating results and all that to help us to solve their medical conditions. Most of the time, it's quite straightforward, but occasionally you have patients that are quite challenging and maybe a complex medical condition. Or sometimes the problem is obscure. You go through all that and you still cannot put your hand on or your finger on what the problem is. So maybe something that may not be straightforward, but it means you still have to go on to investigate further to get to the bottom of the problem. Sometimes deal with patients who have multiple problems, overlapping problems. And so you really have to sit down and tease out the problems. Most of these conditions are usually chronic illnesses. So it tends to be ideal for doctors who enjoy deep thinking, clinical reasoning, and doctors who can recognize patterns in disorders. And so once you see that, oh, the way this case is going, it's most likely the diagnosis A or diagnosis B. And so is good for doctors who want to become like, quote unquote, the detective in medical practice, trying to connect the dots to be able to arrive at the diagnosis. It's in terms of the intellectual challenge, it's very rewarding, as I said earlier. And so it's important that we stay abreast with medical knowledge. Some of the things we were taught in medical school, by the time we got to residency, the evidence had changed, and therefore you need to change your approach. So it means that you need to be ready to learn constantly, to update yourself, upgrade yourself, so that you can grow in your field and you don't stay in the old school. This will help you to be sharp, but at the same time to help to humble you, in the sense that you know that you don't know everything. At any particular time, new things may come up. And sometimes it may be that the very people you are teaching may be ahead of you if you don't keep abreast with the trends. And so it's ideal for doctors who want to be well-rounded in medicine and want to commit to lifelong learning with some clinical curiosity. You always need to be asking the question, why? This is something that some of my mentors taught me as a resident. The question that you need to be asking as an internal medicine resident is why? Why is this result so? Why is this patient presenting in this way? Or why is this patient going through these problems? And so that's what internal medicine offers. It also offers you a diverse career path. That has been said over and over by most of the speakers who've spoken today. And so in Ghana, you can decide that when you go through the training, you stay as a general internal medicine practitioner. And so you have knowledge, adequate knowledge, specialist knowledge across all the subspecialties. And we have about 11 of them when it comes to internal medicine in Ghana at the moment, at least from the Korle Bu perspective. Or you may decide that I don't just want to be in general internal medicine, but a subspecialty in internal medicine. Or you may decide that I've done my general internal medicine, I've done my subspecialty, I want to render service only, maybe at the primary care level or secondary or tertiary, or now that we have UGMC, is supposed to be quaternary care. I mean, you have that choice to practice, to render service. Or you may want to branch into academia, as some of us have done, which involves teaching and research in addition to your clinical service. Or you may want to go into policy, the ministries, the WHO and all those other places. Or as you can see now, a lot of our doctors have also branched into politics, and we have some of our doctors in parliament and holding positions which direct the way in which health is administered in the country. Internal medicine also offers a unique opportunity of building strong, meaningful relationship, long-term relationship with our patients. And so right from diagnosing their chronic diseases through to actually detecting those chronic diseases at an earlier stage, or even preventing them from occurring, we, as internal medicine specialists, you can play a very vital role in the various stages of our patient's life. And once you have a patient with a chronic disease, you have to build a good relationship with them, because they'll be seeing you over and over and over again. And many of us can attest to the fact that we have patients we've been seeing, some of them even from when you were a house officer, or after you specialize, you've been seeing these patients for many years. And that's what internal medicine does. And this slide, maybe I'll skip it, but I was trying to compare the characteristics of internal medicine and surgery. I would just want to focus on the primary, on internal medicine. As I said earlier, it involves clinical reasoning, and also you need to think about the complex conditions We deal with adults who have chronic medical conditions that are complex sometimes. It requires that you use cognitive skills and diagnostic skills and long-term care. When it comes to procedures, yes, there are some procedures in internal medicine, but compared to surgery, it's not high volume. But if you are interested in procedures and still want to practice internal medicine, depending on subspecialty you choose, you still can do some very amazing things when it comes to procedures. In terms of practice, it's flexible. Internal medicine, all you need is your brain, good knowledge, and your skill, and you can go and practice anywhere. Surgery, if you would need the infrastructure to be able to practice fully wherever you find yourself. And because it's a little bit more flexible compared to surgery, in that for surgery, you may need longer hours in the theater, and you can't leave until you've done what you're supposed to do. Internal medicine, a little bit more flexible than surgery in that sense. So in summary, I would advise that you consider specializing in internal medicine if you enjoy making diagnoses, thinking through complex problems, and also enjoying taking care of patients in the long term. If you are somebody who wants to broaden your knowledge in adult diseases, such that you want to stick with general internal medicine, or you want to broaden your knowledge and deepen it in a subspecialty area, you can think about internal medicine. It's also good for somebody who, if you appreciate the flexibility in your career path in terms of not spending all your time in the hospital, but then you have a flexible work-life balance such that you can also take care of the family, which is a very important aspect of our lives as we go along in this life's journey. And of course, if you are not interested in performing surgeries, then I think internal medicine will be a place for you to be able to still see patients and make a difference in their lives. So once you've decided that I think internal medicine is for me, and the next thing will be, where do you want to do your internal medicine? We've heard from Eunice from the US, we've heard from Mercy from the UK, we've heard from Patrina, who is on both sides from UK and also in Ghana. And if you decide that Ghana is where you want to stay, then looking at trajectory, when you finish or you qualify as doctors as the class of 2024 you've just gone through, you're going to go through your house job. Then after that, you will become a medical officer. As a medical officer, usually you'll be posted to a hospital. It could be in a district, it could be in a region, or it could be in a teaching hospital. And it's during this phase that you can start your residency. And the residency, or you decide that I want to do residency. And with the residency, if you complete your residency, the part 1 or the membership, then you are usually referred to as a physician specialist if you are in the Ministry of Health workspace. Then you'd move on to do your subspecialty, and when that's what I'm referring to as fellowship training or senior residency. And when you complete that, you are given the title, or you are promoted to a senior physician specialist. Or if you did the subspecialty, then you can be appointed as a consultant in that subspecialty. And from then on, there are other career pathways that you can choose, as I've already stated. So to enter the postgraduate program, in Ghana, there are 2 colleges. We have the West African College of Physicians, and we have the Ghana College of Physicians and Surgeons. In Ghana, the Ghana College is in charge of postgraduate training. And so in certain aspects of the training, you cannot bypass the Ghana College. Okay, so the fellowship, the training is, we have the entry into the program, which requires that you take an exam that we call the primary exam. And then once you are selected to the program, Then you start as a junior resident. You do at the end, you do the membership exam. Then if you decide to move on to do fellowship, you do a fellowship exam after that. So there are 2 examination periods for the residency training. For Ghana College, they do their exams in March and in September. So every year, March and September, there will be the opportunity for people to write the primary exam, the membership exam, fellowship exam. And the West African College does their exams in April and October. So once you take your primary examination, which is the entry examination, usually, as I said, you take it as an MO. There's this reciprocity that exists between Ghana College and West African College, so that you don't have to take the primary exam for both colleges. Okay, you would definitely have to take a primary exam, and once you take the exam and you pass, you would apply to do your residency. And usually the application is just for you to choose the specialty area you want to do your residency in, and then the hospitals that you'd want to do the residency training in. And so the specialty at this stage, what you are choosing is whether I want to do medicine, I want to do surgery, I want to do ONG or pediatrics, anesthesia. There are other subspecialties that you can, other specialties you can choose. And you attend the interview, you're successful, and then you are posted to the training institution to start the membership training, or what we refer to as junior residency. It's a 3-year program. And for internal medicine, you'll be exposed to all the subspecialties that are available. And there's a well-coordinated training program guided by the curriculum that is used in training residents. And it spells out the content, the duration of the various rotations very clearly. And there are various learning opportunities, or several learning opportunities available during the residency training. I will skip that slide and move on. So once you've gone through the training, then you would write the membership examination, which has as an MCQ component, which is computer-based. There's a clinical picture session, and then there's a clinical examination, which is in an OSCE format. So tomorrow, we'll be doing the West African College exam for the clinical exam for our residents who are the junior residents who are ready, who have applied for the exam. Then once you finish you pass your membership exam, then there's a fellowship training. In the past, when Ghana College was set up, the aim was to get a lot of specialists, that is those who've done membership, train them so that we can fill the district hospitals and other regional hospitals with specialists to be able to take care of patients. But with time, realized that there was a need to add on the subspecialty training. And so subspecialty training in Ghana College is also available. It's for 3 years duration. After your membership, you apply for it, also to select which subspecialty you want to go to, and then the training institution where you want to do the program. And once you're successful, you will be posted to the institution for the training. And you can train either in general internal medicine or in a particular subspecialty area for the fellowship exam. And so during that period, there's also a well laid out, clearly specified curriculum with what you need to do, how many weeks of this you need to do for each subspecialty. And some of the rotations you may have to go outside internal medicine because they are related to it. So something like endocrinology, you have to do rotations in neurosurgery, ophthalmology, nuclear medicine, because they are all related to the subspecialty program that you're doing. And also involves being at the end, doing a project or a study and writing a dissertation as part of the exam. Then you write the fellowship examination, which also has, you'll be examined in internal medicine again, because we don't have that many doctors in Ghana. And so we still want, as a subspecialty person, you still should be good with general internal medicine wherever you find yourself. So you'll be examined in internal medicine, then in your subspecialty, then you defend your dissertation. So that's the training when it comes to in Ghana. That's the bird's eye view of what the training looks like in Ghana. So I would end here, but before I do, I'd just like to say that as newly qualified doctors, as you are ready to face the world and you are thinking, what should I do? What should I do? I think the most important thing is that you need to know yourself. You need to know where your strengths are, where your weaknesses are, what your passion is, and that will help you a lot in deciding where you want to go to. So that it gives you an idea, helps you to give you an idea of the career path that you would like to choose. But you should also plan to have a good work-life balance, even as you go through the training programs. A good work-life balance is very essential. It's important that you speak to colleagues, just like this program you are speaking to or getting some information from mentors and senior colleagues. In your workplace, speak to other colleagues, speak to other senior colleagues, get more information, particularly about the area where you think you want to branch into. And that would help you to make a good decision regarding your career path. Do not forget to stay well grounded. Be ready to learn. I mean, once you finish, you realize as you go through the ladder, then you realize that learning is not, you don't stop learning once you qualify. It's a continuous thing. Even if you don't have an exam, you should be ready to learn to develop your profession, develop your career. And it's important also that you stay humble, knowing that you do not know it all. No matter how much you learn, every day something new is coming up. And so you do not know it all. And therefore, in that regard, you want to continue learning and stay grounded. So I'll end here. Thank you very much for the opportunity.
Thank you very much, Paul. Thank you for giving us an entire pathway to Ghana. I hope there are some people on the call who have learned a lot about the process and have gained more understanding into the whole process in Ghana and how to enter an internal medicine specialty. So today's session was for the physicians, the medical specialties, and it was basically to prime us before we create the mentorship program or the mentorship schedule that the committee is coming up with. We have very brilliant minds that have been meeting to try and come up with a plan and a schedule so that our very able alumni who are so ever willing to help us gain guidance through this very difficult world in terms of determining a career path in medicine and navigating our way through life. So we would like to start the question session. And if anybody wants to ask a question, you can kindly raise your hand and then I unmute you. You could also text the question into the chat box and then we can read it out. So if you want to direct it to any of our 4 speakers, kindly add an @ sign or add the person's name to the message so we could have it answered. We're a little bit behind time, but this has been very successful and smooth so far. So do we have any persons who want to have the opportunity to unmute to have their question answered? Okay. So far, there's no message in the chat box. Mm. Dr. Brenda, please, you can go ahead.
Right. So, thank you so much. Honestly, it's been a very insightful debut edition to this, and we're really grateful to all the speakers. Mercy was talking about um, trying to get some kind of attachments and things like that in the UK. And I just wanted to say recently, it looks like it's been a bit difficult. Usually when you come and do your attachments or you do your clinical attachments here, it's easy to kind of get a job. But I realized that it's getting more difficult now. I'm not sure why, but there was a Nigerian guy who came, did the clinical attachments for about 6 weeks. And at the end of the day, we tried to see whether we can get a job. I tried talking to consultants and things, and unfortunately he had to go back. And then there was an Indian guy as well who came, and it was the same story. And I realized that actually the system is a little bit choked. So just to sign a warning there that it's not very easy at the moment trying to get jobs and things in the UK. I don't know whether it's just pediatrics, but at least in pediatrics, that's what's happening. Thank you.
Thank you very much, Dr. Brenda. Please, does anybody want to ask a question? Okay, so I have a question. As we wait for other audience to ask their questions. So my question is about balancing it all in terms of choosing a medical path or career, especially when you are confused and you feel like you may fit into both a medical career and then a surgical career. You want to use your hands, you also want to use your brain. How do you decipher which to go towards? And are there any specialties that cut across and give you the opportunity to do both and kind of blending your interest in medicine and your interest in surgery? Thank you. So anybody can answer this question.
Can you hear me?
Yes, please, we can hear you.
Okay. So for internal medicine, we have gastroenterology, where you have a lot of procedures. So these days they have advanced endoscopy where they can do procedures using the scope. So GI is one of the specialties in internal medicine where you have a lot of procedures, as well as cardiology. They have a lot of procedures, and even now pulmonary, they have interventional pulmonologists. So internal medicine, we have specialties that involves procedures that you can go into.
Okay, thank you very much. Just so that things flow more quickly, I've allowed for the speakers to unmute automatically. So you can try unmuting.
Yeah, thank you.
Thank you.
Yeah, so I think I was going to say exactly what Eunice has said when it comes to internal medicine. But family medicine, at least in Ghana, family medicine also can offer you that opportunity as well. I don't want to drive you from internal medicine to family medicine, but just to let you know that in family medicine training, it cuts across. So if you want to use your hand, and please don't say use your brain and your hand. The surgeons also use their brain. It's just that they use their hands a lot more. So they also use their brain as well. And you also look at your energy. I mean, as I said, I wanted to do surgery at the beginning. But I just looked at the time I'll be standing on my feet, maybe for hours doing some surgery. And I didn't think I had that energy to be able to do that. And I wanted to do something that when I'm doing it very well. And so look at your energy as well. If you don't think you can withstand that standing for hours, and trying to save a patient, and then you can come and join us, and you still get the opportunity to use your hands as well.
Okay. This is Dr. Petrina. I mean, to add to that, I'm a family medicine, I'm a GP. But in the UK, I did a course in minor surgery. So then things like little lipomas, minor surgeries, I'm able to do it. So even though I'm doing my family medicine, I still do a bit of minor surgery. Now I'm doing a little bit of weight management, and now there are all these equipment that you can use and that they call, they sort of use in non-invasive liposuctions. There's a lot of things now that you can do as a doctor, as a family medicine practitioner. The whole, basically, a whole scope has been opened up for you. You can also go in. It's basically what you love to do. That's, I would say, go with your heart, but then know what your goals are and where you want to be, and know what you love doing. That's more important. Because you can say that, oh, yes, I want to do medicine, I want to do surgery, I want to do this, but ask yourself, are you happy to see a number? What would you be happy to do as a doctor? And just focus on that and just go for it. And as you do that, opportunities will keep opening, because day in, day out, medicine is changing, medicine is opening up into different areas. So just go with it. But as I said, as a family medicine practitioner, you can still do minor surgeries as well.
Thank you very much, Dr. Anka. Please, do you have anybody who wants to unmute and ask the questions? Feel free to do so. Okay, so somebody is asking. Okay. Yes, please, you can go ahead.
Hi, my name is Frank Baden, and I'm really happy to have been through listening through this session all this while. Thank you very much to all the speakers. It's been a fantastic opportunity. It takes me back to when we were incidentally Josephine, Patrina, and Eunice are also my mates. Mercy was my senior. Now, and it takes me back to the days where we wished we had such opportunities at that time. So I'm really happy that there are people on the platform who are, benefiting from this. And it's really congratulations to all who set it up. One of the things that gets lost in the discussions, and it's something that we very often do not speak about too much, I don't know why, is the issue of private practice. I just want to hear the thoughts of the speakers on internal medicine private practitioners and how it fits into the career of people. Is it usually after the membership level, or is it after the consultancy level? At what point should they consider private practice as an option as far as the career path is concerned? Thank you very much.
Hi, can I say something? Hello?
Yes, please.
Hello?
Yeah. So in the UK, the healthcare system is by and large the National Health Service. So private practice in any shape or form is usually locum work. That's the safest. To go entirely private, you'd probably have to have finished specializing to become either a consultant or a GP, complete your training. But anytime in your training, you can do locum work, which you can do through your limited companies or whatever. That's considered as private practice. I'm not too sure how lucrative private practice is for internal medicine. I don't see a lot of medical people who did medicine going into sort of private practice because the system is not geared towards private work. Your private work will more or less be locum work where you are paid an hourly rate, which is quite high, and it will go through your limited company. And you can do that anytime in your training from foundation, from, as a junior doctor right up to consultant level. Surgeons can do some private work because they just go in quickly and go and cut and go. And even that, it usually impacts on your NHS work. It can get very cumbersome, you know. So most people do not do private work in that sense. And what we consider private work is doing locum work where you are paid a higher rate. Sorry, there's a bit of noise. Okay, thank you.
Okay. I think my little contribution to that is from what I've noticed, I mean, private work is something that can be done because I have a group of internal medicine physicians that I work with, and they are doing private work, but it's a partnership. So we're in a situation where I have a group of 5 physicians they formed a company. I'm part of it, and it's also steamed as private practice anyway. I know in the UK, with some of the private hospitals that I work with, they do have people on their list, either from internal medicine, from surgery, from the different specialties on their list as well, who have officers and have secretaries in these private clinics. But then they still work for the NHS. So they come to the private hospital specific days and they are all set up. So I don't know whether that's a sort of a model that's coming up for future practice as a doctor. But being a standalone person in private practice, I don't think it's the way to go, is what is going now when you look at the future of medical practices. Hello?
Hello, thank you.
Okay.
So are there any more questions? So somebody is asking, if ophthalmology, so Dr. Stephen Akafo is asking if ophthalmology offers both medicine and surgery in one specialty for those who love both. Thank you very much.
I don't think he's asking. He's contributing
Just
to the
added, yes, it's
yes.
contributing to it.
Yes.
Okay, yeah, Dr. Stephen Akafo.
Yes.
He's one of the alumni.
Yes.
Yes, he's just saying that you can get both practice general medicine and surgery and when you do ophthalmology. I think it was adding to it.
Okay, thank you very much. Please, are there more questions? You can unmute and ask any question if you want to. You can also text in the chat box.
Hello, Kalaja.
Yes, please.
Yeah, sorry, I'm back again. My question is actually to you. And how do you, from the junior doctor's perspective, how do you see the horizon in terms of opportunities of now that you've graduated? I mean, how do you see it? How do you see the prospects? We've said about all these lofty areas and the challenges and the prospects and all that. But I want to see from the junior doctor's perspective today. How does a junior doctor see what the next steps are? Is it that daunting? Does it have hope? Does it reflect, the thing that we have been saying? Is it like it's reflective of what you've been thinking about?
Yeah, thank you very much. So I'll give a bit of my thoughts on this and then open the floor for anybody who would like to share as well. So the future for me and for most of my colleagues, the few conversations I've had with some of them currently is it looks very scary, especially with the advent of artificial intelligence and the fact that it could take over careers in the few years to come, especially if you're a surgeon, I think both specialties from research papers and articles and what we see on social media at risk, whether medical or surgical specialties, even other jobs are also at risk of losing relevance. And that's one of the biggest fear we have. And it goes a lot into deciding which path you want to take. Especially people think already AI is beginning to see patients, is going to replace us very soon. And so it makes it very difficult to decide. That's one of the big factors in our current generation. Also, aside that, the usual decision to make family, especially, I don't know, it's funny that this session had a lot of females, so it's quite not everybody was female in this session. It was quite inspiring to see how you have to balance the decision between deciding on what your spouse wants for your children and also being understanding and going for what you are truly interested in. So that's also one of the biggest issues. And I think it runs across even from generations before our generation. But currently, technology is one of the biggest threats, in my opinion. I don't know if any of my colleagues would like to unmute and contribute as well. Manzoaya, Dr. Yakubu might want to share a few words on this.
Hello, good evening. Please, my name is Manzoya Yakubu, and I think, like Pelagia said, the advent of artificial intelligence is a very scary thing. But I am of the view that I think the future is exciting. I think that if you look at the like I'm speaking specific to Ghana. If you look at how much has changed over the last few years, let's say maybe like 20 years, I think that the medical space in Ghana is quickly evolving. And I know it got to a point and has gotten to a point where a lot of people want to leave because it looks like things are better outside than in Ghana. But I also believe that a lot of efforts have been made to make medical practice in Ghana more efficient and closer to what it is outside. And so I think that in the next few years, it's going to continue to undergo very rapid change. And I'm excited to see what the future has in store for us. Thank you.
Thank you very much, Dr. Yakubu. Do you have any more contributions? Sorry, why are you in the oh, we're not supposed to.
My name is Dr. Awuvi. On my end, I feel like, just like Dr. Yakubu was saying, this future is very exciting. But I feel like, at least for me and a lot of the people I talk to, we all been a bit shocked at how stressful the work actually was. At least for me, I knew like medical school was hard, but the job is like much harder, and having to deal with the fact that any decision you make impacts somebody's life or their prognosis is very intense. Also starting to unravel what you want to do, where you want to go. There's like so many options that it's kind of difficult to decide what you want to do. So yeah, there are a lot of different fun things to do and interesting things to do. Interventional procedures, traditional surgery, public health, and they all look very interesting and promising. But I think sessions like these will also help us get some form of clarity, and it's great that we are having sessions like these. That's my opinion.
Thank you very much, Dr. Awuvi. So we have a contribution with no name. From the junior doctor's perspective, we are trying to stay hopeful. It looks like it's a lot harder to march into the US given the volume of applicants. Friends who are also pursuing the UK route seem to be struggling with getting placements. And in Ghana, there is a backlog with posting medical doctors. And there also seems to be a queue in the number of doctors waiting to be sponsored for residency. We are simply remaining hopeful. That's such a. Dr. Frank?
Yes,
Please, do you have
hello.
any more
Yeah, thank you very
contributions?
much.
Thank you
Go ahead,
for
please.
asking the question and allowing us to air our concerns and fears with the future. Please, do you have any more questions?
Hello?
Yes, please, you can go ahead.
No, I'm fine. I'll just appreciating the feedback and thank you very much.
You're welcome. Please, do you have any more questions? I see a
Please, I
hand.
have 2 questions.
Yes, please.
Yeah, so
Please
my
go
first
ahead.
question, I want to ask if it's possible for internal medicine, if it's possible to, I know for Ops and Gynae people do it, whether it's possible to do both Ghana College and West African College at the same time. And then if it's also, I read, I know there used to be a fixed number of years you have to be a medical officer before you can apply for certain residency. Is there a fixed number of years for internal medicine? Thank you very much.
Okay, so you can do both West Africa and Ghana College. So usually the advice is try and do both. And because of where the exams are scheduled, once you're learning for one, you might as well do it for both. So it's not like you do one and then wait 6 months and do the other. It follows 1 month after, and you're allowed to do both. And usually I advise you to do both. It's only the primary that you can do one and then you can enter the residency. Well, in terms of the number of years as a medical officer, I think because Ghana College controls the entry, I think in their as part of the entry requirements, I think it was supposed to be 2 years as a medical officer, but that has they've made some changes to that, particularly for specialty areas where they don't have a lot of doctors going in. And so I think psychiatry, anesthesia, I can't recall all the areas, radiology, I can't recall all, but there are some areas where lots of doctors were not applying. And so they removed that requirement so that once you finish your house job, you can go ahead, write your primaries, and then apply. And that's so far, I think, has increased the number of doctors who have applied for those areas to increase the numbers of specialists in those areas. But I think traditionally it was supposed to be 2 years before. But that I think they are looking at it, and for now it's some specialties that requirement is not necessary.
Thank you very much.
Thank you, Prof. So if there are no more questions, we would like to give the vote of thanks, and then is there somebody who wants to ask a question? So someone is sharing their video. And then I also like to advertise next week's session. So this session was for the physicians, the medical session, and next week promises to be as exciting as this one. Would have, I don't know how it happened, but it wasn't planned. In case anybody was thinking it was planned, but somehow, all our physicians ended up being females. Cause it was purely coincidental, and then our surgeons are males as well. So let's not think it was a planned thing, but we are happy that everything was successful at the end of the day.
Sorry,
I'm sorry.
yeah. Can
Yes.
I quickly just say that, just to alert people that the mentors we've got, like I said, we got about 40 mentors who are keen to also be on here. Some of the specialties we have are obs and gynae, ENT, urology, radiology, public health, pediatricians are here, pathologists are here, laboratory medicine doctors are here, anesthesiologists are here, psychiatry and dentists as well. So just to let you know what's the range of people who we have on the mentors list. Thank you so much.
Thank you. Thank you very much, Dr. Brenda. So as Dr. Brenda was saying, we have a lot of resources at our disposal. They probably didn't have that in their time, and they are willing to sacrifice and give us all their time and mentor us to deciding on our career path. And we are very grateful for that. So on that note, I'd like to express a heartfelt thank you to all our incredible mentors, both those who were able to make it today and those who are going to be on board for our mentorship program. We are very grateful for their time. To dear Dr. Brenda, Dr. Bertha Ayi, you've been so wonderful in terms of the planning of this program. I know your schedules have been very heavy and hectic, but you made time to make this program a reality. And we are very grateful for every single time that you've expended for this program and for the mentorship sessions we are going to have in the future. To our speakers, Dr. Patrina, Prof. Josephine Natalu, Dr. Eunice, and Dr. Mercy, we are so grateful. And on behalf of the entire University of Ghana Medical Students Association alumni, I'd like to express our deepest gratitude for the invaluable contributions you made and the impact you made on us this evening. We thank you for everything. The funny thing in this whole session is that it ended up that most of our speakers had competing commitments. Some had to travel and even joined on their way to their destinations. Some had family gatherings. Some had all sorts of obligations, but they still made the time to make this session a success. And I can't overemphasize the appreciation from class of 2024 and all the other classes that were able to join for this truly inspiring session. We thank you for investing in the future of University of Ghana medical students and alumni, young and baby alumni. And we hope that we'll be able to match up to the laudable heights you've been able to achieve in your lives and careers in the medical field so far. Thank you. And on this note, I'd like to give the opportunity to Dr. Brenda if she wants to give us any more announcements regarding the resources available on the website.
I think at the moment we will end the year because as our time is fast spent. I think next week we have another session and we can probably bring a few things on board as well, and then see what we do next, what that your team would like us to do next, so yeah. Thank you so much. You two have been amazing as well, organizing all this, putting up the flyers and all that. It was all you, and we are grateful. Yeah, God bless. Okay, thank you.
Thank you very much. So on this note, I'd like Dr. Joseph Abbey to give us the closing prayer, and see you next week. Same on Saturday. This time is going to be on a Saturday for the
Yes.
surgery session. Yes.
Yeah.
So Saturday, the 11th of October.
Thank
Same
you.
time.
Yeah.
So Dr. Abbey. Okay, so Dr. Abbey is having some network challenges. So I'd like Dr. Yakubu to give us the closing prayer so we can end.
Okay, shall we pray? Our Heavenly Father, we thank you for a successful meeting. Father, we thank you for the rich wealth of resources and resource personnel you've given us, for the mentors you've blessed us with. We thank you for the lives that they've lived and everything you've taught them throughout their lives. And we thank you that you've given us the opportunity to benefit from everything that they've experienced to make our journeys easier. But I pray that through them, you shall help us to find our paths and help us to walk them to your glory. So at the end, all the honor and adoration will be yours. In the mighty name of Jesus, we pray with thanksgiving. Amen.
Amen. Thank you so much, Dr.
Amen.
Yakubu. Thank you everyone for joining in. See
Thank
you
you.
next
See you
time.
next. Amen.
Thank you.
Yes.
Thank you
Next week.
so much.
Thank you
Thank
so
you.
much to all our speakers. Have a good night and
Good
enjoy the
night.
rest of your. Bye.
Thank you. Bye. Bye.